The closure of USAID, a wake-up call for global aid and humanitarian efforts. The recent shutdown of the U.S. Agency for International Development, USAID, has sparked significant criticism from former presidents Barack Obama and George W. Bush, as well as numerous humanitarian organizations. Officially ending its operations, USAID was responsible for distributing American aid around the globe, a role it held since 1961. The agency's scaling back began during President Trump's second term, when the focus shifted towards trimming what was seen as inefficient federal personnel. But here's where it gets controversial. The consolidation of USAID's remaining programs into the State Department has been met with sharp disapproval, particularly due to projected consequences highlighted in a Lancet Medical Journal report. This report suggests that these cuts could lead to more than 14 million additional deaths by 2030, with children making up a third of those at risk. Despite these alarming figures, a State Department official argued that the findings were based on incorrect assumptions and maintained that future aid would be managed more effectively. And this is the part most people miss. Founded in 1961, USAID once employed around 10,000 staff, most of whom were stationed abroad, playing essential roles in disaster relief, healthcare, and humanitarian aid. The abrupt conclusion of these humanitarian efforts has stirred global concern, especially because programs providing critical medical support and emergency preparations were significantly curtailed. Let's engage in a conversation. As we reflect on this monumental shift, it's worth pondering, should the prioritization of national interests compromise global humanitarian aid? Your thoughts and perspectives on this complex issue are incredibly valuable, and we invite you to join the discussion in the comments below.